So once again, my name is Bill Arnold. I'm Senior Director of Alumni and Family Engagement here at Alma, and so glad to have all of you here for this version of our Tartan Talk series, THC and CBD, the ABCs of cannabis and cannabinoids. We'll get into the webinar in just a minute, but just a little bit of housekeeping details. We will ask people to keep their microphones muted throughout the presentation, just simply because that helps cut down the background noise that can happen inadvertently. We do have a text chat feature for those of you who are on a computer, a tablet, or laptop. If you scroll over the Zoom window that is on your screen, there's in the bottom of the window, there's a little menu, and you will see a chat, a thing that says chat, and a bubble there for a chat bubble. If you click on that, that'll open another small window, and you can send messages, text messages, to me or to the entire group. I will be monitoring that throughout the presentation, and if you have a question of clarification for something that Jennifer says while she's speaking and would like her to clarify, you can send a message there, and I will interject that with Jennifer so that we can get that question asked. We will do a primary question and answer at the end of the webinars. After Jennifer runs through all of her content, we'll spend the last kind of 5 or 10 minutes with a more in-depth question and answer process. But again, if you have a question for clarifying or review something or a point wasn't clear, feel free to interject that during the presentation. Also want to let you know that we are recording this session, and so it will be available for others to view, for you to view later, or others that weren't able to join us this afternoon for this live webinar session. And that will be made available through the Tartan Talks website, which is embedded within the college's overall website. So I think that's all the details that I need to run through, but again, glad that you're here with us this afternoon. And I'm really excited to have Jennifer Yirsa Weston joining us for this webinar. As you can see on the slide, Jennifer is class of '94 from Alma College. Following her time at Alma, she went down to Baylor College of Medicine to pursue her Master's of Science in the Physician Assistance Program. And since that has been in other, working in that field, currently works at the Family Medicine Clinic in Lansing. And so just a pleasure to have Jennifer on with us today, and she agreed to do this. We had a conversation because Jennifer and I have connected in the last couple of years around some other alumni things, and just asked that would you be willing to do this, and she gratefully or willingly said yes. And then we were kind of talking about ideas, and she said, this is an area that she's been focusing on given the trends in the state of Michigan, and so I thought it was perfect. So happy that Jennifer agreed to do this with us. So Jennifer, thank you, and I'm going to turn it over to you, and I will take in the kind of a background and monitor the chat board, but let you take it away.
Thanks, Bill. Can everybody hear me okay?
I think I can, at least.
Okay.
I think most people should.
Perfect. Thank you for including me in this really important series that Alma is putting on. I appreciate your alumni engagement opportunity, and I'm really excited about this talk today. So I just want to start off by saying that in no way during this talk am I trying to endorse the use of cannabis products for recreational purposes. I would like to state that I personally have not used cannabis products in the past in any form, and I do not have any financial disclosures in regards to its manufacture, distribution, or sales. So why are we going to talk about cannabis products for this webinar? Well, Bill asked me to discuss something that comes up often in my practice. And in the last 6 months, at least 5 patients a week on average are asking me about the use of CBD or cannabis products for their chronic medical issues, including anxiety, insomnia, chronic pain, or managing cancer treatment side effects. To be honest, this was never even discussed in my training as a PA. That lack of discussion is in large part due to the fact that parts of the cannabis sativa plant have been placed under the Controlled Substances Act since 1970, under the drug class marijuana. It is listed as a Schedule I drug due to its high potential for abuse, which is attributable in large part to the psychoactive effects of THC and the absence of a currently accepted medical use of the plant in the United States. Other examples of Schedule I drugs are heroin, ecstasy, and LSD. In 1996, California was the first state to approve the use of marijuana for medicinal purposes, which has been followed by 32 other states. In 2012, Colorado and Washington became the first two states to legalize marijuana for recreational purposes, and since it has been legalized by 9 other states, including Michigan in 2018. In 2017, the National Academies of Sciences, Engineering, and Medicine published the most current and comprehensive report on the status of scientific inquiry regarding cannabinoids. The following is a summary statement from their report. However, you can download and read the entire report for free at www.nationalacademies.org. Recent years have seen a rapid rise in the medical and recreational use of cannabis, a broad term that can be used to describe the various products and chemical compounds such as marijuana and cannabinoids derived from different species of the cannabis plant. Despite increased cannabis use and a changing state-level policy landscape, conclusive evidence regarding the short and long-term health effects, both harms and benefits of cannabis use remains elusive. A lack of definitive evidence has resulted in insufficient information on the health implications of cannabis use, causing a significant public health concern for vulnerable populations such as adolescents, pregnant women, and others. Unlike substances such as alcohol or tobacco, no accepted standards exist to help guide individuals as they make choices regarding if, when, where, and how to use cannabis safely, and in regard to therapeutic uses effectively. With support from a host of federal, state, philanthropic, and non-governmental organizations, the National Academies of Sciences, Engineering, and Medicine convened an ad hoc expert committee to develop a comprehensive, in-depth review of the most recent evidence regarding health effects of using cannabis and cannabis-derived products. In the resulting report, The Health Effects of Cannabis and Cannabinoids, the Current State of Evidence and Recommendations for Research, the committee presents nearly 100 research conclusions. The committee also formulated recommendations to expand and improve the quality of cannabis research efforts, enhance collection efforts to support the advancements of research, and address the current barriers to cannabis research. To summarize those findings briefly, there was conclusive evidence that cannabis is effective for the treatment of chronic pain, as an antiemetic in the treatment of chemotherapy-induced nausea and vomiting, and to improve spasticity for patients with multiple sclerosis. There was moderate evidence that cannabis is effective for improving short-term sleep outcomes associated with obstructive sleep apnea and the pain associated with fibromyalgia and MS. There was limited evidence that cannabis was effective for increasing appetite in HIV and AIDS-related weight loss, for Tourette's syndrome, or for improving anxiety or PTSD. I want to make clear that these studies were carried out in adult patients. The use of marijuana for persons under the age of 24 may have serious long-term effects on brain development and is not advised. According to the CDC, the teen brain is actively developing and often will not be fully developed until the mid-20s. Marijuana use during this period may harm the developing teen brain. Negative effects include difficulty thinking and problem solving, problems with memory and learning, impaired coordination, and difficulty maintaining attention. Regular use of marijuana in adolescence or early adulthood can lead to a decline in school performance. Students who smoke marijuana may get lower grades and may be more likely to drop out of high school than their peers who do not use. There is also an increased risk of mental health issues. Marijuana use has been linked to a range of mental health problems in teens, such as depression and anxiety. Psychosis has also been seen in teens at higher risk, such as those with a family history. Driving while impaired by any substance, including marijuana, is obviously dangerous. Marijuana negatively affects the number of skills required for safe driving, such as reaction time, coordination, and concentration. Research shows that about 1 in 6 teens who repeatedly use marijuana can become addicted, which means that they may make unsuccessful efforts to quit using marijuana or may give up important activities with friends and family in favor of using marijuana. So let's just give a few definitions so everyone can understand the differences in the types of products that we'll be discussing today. Cannabis is simply a genus of flowering plants with 3 different species: indica, sativa, and ruderalis. Most products are made from the indica and sativa varieties. It has been reported that the plants have different properties, such as the sativa plant being known more for its activating qualities, for day use, having it be more uplifting, increasing your energy, and relieving depression. Whereas the indica species is known more for drowsiness, relaxation, decreasing anxiety, stimulating the appetite. This is a little bit of a misnomer, however, as there has been a tremendous amount of breeding various varieties of plants, whether they are indica or sativa, to have certain desired characteristics. These plants can be bred to have low amounts of psychoactive compounds that are used to make hemp, or high amounts that are used for recreational or medicinal purposes. THC, or tetrahydrocannabinol, is the primary psychoactive compound in cannabis, and its metabolites are what are tested for in a drug screen. There has been a 57 to 67% increase in the concentration of THC in marijuana products of today over that from the early 1970s. Marinol is a synthetic form of THC, and it is indicated in adults for the treatment of anorexia associated with weight loss in patients with AIDS. It is also indicated for the treatment of nausea and vomiting associated with cancer chemotherapy in patients who have failed to respond adequately to conventional antiemetic treatments. CBD, or cannabidiol, is the second most common active ingredient in cannabis, and it seems to be generally very well tolerated. It is not psychoactive, but yet has anticonvulsant and anti-inflammatory effects. It is actually thought to protect against the psychoactive effects of THC. What I mean by that is if a patient is having side effects from THC products, the patient could administer CBD to counteract those effects of the THC. So why are patients asking me about this? Most have heard there are benefits to using CBD products for pain relief or to help with sleep or anxiety. In general, this is all anecdotal information. There aren't many formal studies because of the limitations on studying controlled substances. In October, I went to a continuing medical education program in Ann Arbor, and there were 2 lectures by a Dr. Daniel Claw at the University of Michigan, who is a researcher and clinical physician. In order to conduct research using THC products, he had to partner with Alma of Medicine, a medical and now recreational provisioning center in Ann Arbor, co-owned by Evan Litness, in order to be able to conduct the research using cannabis to treat pain. Their research for this particular study, which was published in the American Pain Society Journal, focused on patients who were using opiates, benzodiazepines, non-steroidal anti-inflammatory drugs, and other pain medications to control chronic pain. They hypothesized that using CBD and combination CBD-THC products could help with pain control. They found that 88% of patients reported that their pain had improved, and that 71% reported that their overall health had improved after using a combination of CBD and THC products. 72% of the patients had stopped using opioids, and 68% of patients had stopped using benzodiazepines after starting cannabis treatment. Why is this such important data? It is estimated that there are 2 million people in the United States that have a substance use disorder involving opiates. Chronic opiate use can lead to dependence, addiction, opioid-induced constipation, and decreased respiratory drive, which can result in death. Opiates were involved in 47,600 overdose deaths in 2017 alone. Contrast that with one possible death related to vaping THC in the summer of 2019. Otherwise, there has been no known overdose deaths related to the use of cannabis. As a healthcare provider, it is important to be able to offer patients with chronic pain an alternative to using a highly addictive, dangerous pain medication. Alma of Medicine in Ann Arbor currently has 4 ongoing IRB-approved studies investigating various aspects of cannabis use and several disease states. As part of my preparation for this webinar, I went to Alma of Medicine in Ann Arbor and talked to Dr. Litness, who was involved in the research with Dr. Claw. I had never been in a provisioning center prior to that visit, and I had preconceived notions of what one would look like. I was pleasantly surprised by the clean, welcoming, home-like environment that they had. They believe in educating their patients as well as healthcare providers like myself to help provide access to medications that can improve the health of patients and decrease risk of accidental overdose. I found it very informative to talk to Dr. Litness. Again, this isn't included in the curriculum for any PA student that I am aware of. He helped me understand more about the types of products that are available and the length of time it takes for the various products to work based on the method of ingestion. Let's first talk about CBD products. CBD, as I mentioned earlier, isn't psychoactive. It does not contain THC. It will not show up on a drug screen. It is most useful when used alone for patients with anxiety. It is important, however, to use an organic, hemp-derived CBD product, as the hemp plant absorbs a great deal of chemicals from the soil into the plant during its growing process. Many CBD products are in the form of a tincture, a liquid with a dropper dispenser. It is advised when taking CBD tinctures to watch yourself in a mirror while you place the drops under your tongue so you are able to count the drops to determine the dose of CBD you are receiving. CBD can also be used to treat pain in a 1-to-1 ratio with THC. To treat insomnia, it is best to use a product with a higher concentration of THC to CBD. The ingestion of a sublingual, meaning under the tongue, tincture on a fixed dosing schedule every 6 hours, starting at a low dose of 2.5 to 5 milligrams per dose, and every week increasing by 1 to 2 milligrams, was suggested by Dr. Litness as a good dosing option. The goal being to use the least amount of product necessary to achieve the desired effect. The ingestion of a tincture has less, quote, likability, according to Dr. Claw, than inhaling, and there is less risk of bronchitis or cancers of the lung. There is no FDA testing and approval for CBD products as they fall under an herbal product and not a medication product, more like a vitamin. So it is important to use a reputable source for these products. Maybe not the video store down the street or the $10 bottle from China on the internet. CVS Pharmacy sells several CBD products like topical creams and roll-ons. On the internet, a company called Charlotte's Web is a very well-respected online CBD distributor. They have a very large selection of CBD tinctures, gummies, and topical creams in various strengths. However, going to a provisioning center where you can talk to a knowledgeable staff member may be the best option. This slide shows several of the CBD and THC tinctures that are available at Alma of Medicine. It is also advised to counsel patients on the method of administration, especially if one is naive to cannabis use. Each method of administration has its pros and cons. It's always advised to start low and go slow to avoid unwanted side effects. This chart shows the onset of action, time to maximum effect, and length of action in the body of the various preparations available. Inhaling or vaping the products causes a much quicker release in the body. However, it has a relatively short length of action, and there is a need for more frequent inhalations multiple times a day. Ingestion of an edible form can take 2 to 3 hours to take full effect, but may last for 6 to 12 hours. Some people have had bad experiences with edible forms of cannabis, as they only waited 30 minutes, and if they weren't feeling any effect, would consume more. Clearly, by doing so, especially for someone naive to cannabis, could result in ingesting too much of the product and having side effects. When I met with Dr. Litness at Ohm, he recommended a combination of products based on the symptoms that the patient is trying to alleviate. Let's take a moment to discuss an example patient. Mr. Smith, a 75-year-old man, has a history of severe chronic low back pain. He has had 2 back surgeries, and despite exercise and weight loss, he wakes in the morning in a great deal of pain, causing him trouble getting out of bed. He has pain throughout the day and had become dependent on using Percocet 10 milligrams 3 times a day for pain. And he also suffers from opioid-induced constipation, which requires an additional medication to treat that side effect. Dr. Litness would advise the following combination for that patient. Since the effect of the THC vape pen is within minutes, he should use that right away. He also at the same time can have a small amount of an edible product, which will take maximum effect about 2 to 3 hours later when the effects of the vape pen have decreased. The effects of the edible will last 6 to 12 hours. This process can be repeated later in the day with appropriate spacing in between doses to maximize his pain control. It is possible that this type of treatment regimen for him could decrease his use of Percocet and the additional medication for the side effect of the opioid-induced constipation. When starting patients on any type of cannabis product, it's best to start therapy with your healthcare provider's consent and to let your family members and caregivers know what you are doing. It's also best to take your first dose on a day that you don't have to drive anywhere or do any other strenuous activities. The main side effect of cannabis products are dizziness, fatigue, dry mouth, anxiety, nausea, and cognitive impairment. More rare side effects could be paranoia, depression, tachycardia, cannabis hyperemesis, which is the nearly continuous vomiting associated with long-term cannabis use, and diarrhea. Let's discuss some of the safety issues regarding these products. Cannabis is metabolized through the cytochrome P450 system, which means the blood levels of many common prescription medications like Coumadin, certain antidepressants, anti-seizure medications, and cholesterol-lowering medications called statins can be affected by the regular use of cannabis. And again, CBD products are not regulated by the FDA. It is important to trust your source of CBD products. All of the THC-containing products sold at Ohm are tested in an ISO certified laboratory for purity and dosing. That means the square of an edible will have exactly a dose associated with it. One gummy will have specifically so many milligrams of THC. The dosing, as well as the purity, can be trusted. You have likely heard about the issues with lung infections that are very serious, possibly requiring double lung transplants associated with vaping. But these were found to be from black market THC products. These cartridges were cut with vitamin E oils to make a more dilute product to save that company money. The safety of the people using them was not a concern. These cartridges mainly came from China. If you are going to use a THC vaping product, go to a provisioning center and buy an ISO tested product. So in closing, I hope that I have provided some useful information on CBD and THC products. And although I don't consider myself an expert in the use of cannabis products, I'd be happy to try to answer any questions you have, or if I'm not able, try to find out the answers and get back to you as soon as I can. Thank you for your time.
Great, thanks Jennifer. As a reminder, what we do have the text chat feature as a means for posing questions. So again, if you're on a computer or tablet, if you scroll over your screen, in the bottom of the window, there's a chat indicator, an icon. If you click on that, that'll open another small window, and you can enter a message to pose a question. We did have a couple of questions that were presented via email earlier, so I'm going to put a couple of those out there, and Jennifer, if you have any perspective on that you can share, I will have you do that. So one of those was, is there a way for individuals to verify CBD product that they're purchasing is free of THC or doesn't have THC in it? Is there a certain indicator? Is there a label? And again, you mentioned that the FDA doesn't control this, and so are there requirements for labeling, and how would someone know if the product had THC or not?
Well, again, because it's not regulated by the FDA, there isn't going to be, anything specific on their labeling. But if you use a hemp-derived product, hemp itself does not contain THC. So if you are using an organic hemp-derived CBD product, there should be no THC in it. And again, if you go, a provisioning center would be the best person to confirm that with. But the Charlotte's Web and CVS, if they're selling just a CBD product that is hemp derived, you should be in the clear that it does not contain THC.
Okay. Another question someone posed is, for arthritis hand pain, would you recommend CBD oils or creams? And then how long do they last?
Well,
I think you had a slide that
talks about the different lengths of time of the different products. I can scroll back up to that. I mean, certainly starting with a cream or topical product is very reasonable. We always try to start with the least amount of medication, and something that's just topical is not obviously going to be as absorbed into the body as something orally. So it would be very reasonable to start with a cream product and to probably use it twice a day. It'd be hard the more often you dose something, the harder it is to maintain compliance. So, 2 or 3 times a day would probably be fine for that. The tinctures generally last a little bit longer, so you might be able to get by with just twice a day.
Okay, someone has asked, Jennifer, if you could scroll back to the screenshot of the research article. I think they want to get some information about
Absolutely.
That article title.
That was right there, the American Pain Society Journal. There's several different published studies. This was just one of them, the Journal of Pain.
Okay.
And if they were interested, if someone had chronic pain and wanted to be a part of a study, this here is, there's 4 ongoing studies that OM is doing with the University of Michigan. And these are all university approved, IRB approved studies.
Do you know, Jennifer, one of the other questions is you referenced the one research article. These are some studies that are currently ongoing. Do you know if there are other research? I know when you and I talked, you said there wasn't a lot out there, but someone asked if you're aware of other research articles or pieces of literature that someone could pursue.
I would direct them. Let me scroll back up to this, because this right here, if they go to the nationalacademies.org, they can download and read for free this entire report that summarizes good, bad, all breaks down by different disease states. And it does a really great job of researching all of the material and the data that's out there about cannabis use. So it was very, very helpful to read through this. Lots of information in here.
One of the questions that came in prior to the presentation is someone had a question about which is more effective for RA, which I'm assuming is probably rheumatoid arthritis, maybe, injections or oil.
Oh, they're two totally different types of things. I'm assuming that they're meaning by injection medications like Humira. Those are disease modifying agents, which are completely different than the use. We're talking just with pain control with the use of cannabis. It's not going to modify the disease at all. Those injections for rheumatoid arthritis actually stop the disease from progressing in the body. So they're very different. And I would think that under the care of your rheumatologist, if you had RA, that they would be okay with you using your disease modifying agent in addition to a topical or oral CBD product to help with pain.
Okay. I think there was a related question to that, but I think what you just described kind of answered that, is that one of those is actually a medication for the condition, and why it would be prescribed by a physician or managed by the physician, and then the other things would not necessarily be a prescription.
Correct.
Okay.
Yeah, there is no, other than the I'm sorry, go ahead.
No, go ahead.
Other than the Marinol, specifically for the two indications that I mentioned, the AIDS wasting syndrome and severe chemotherapy, nausea and vomiting, there is no other approved treatments for use of Marinol. So it becomes, I mean, it's all off-label, and that's why a lot of healthcare providers may be very hesitant to prescribe it if it's not for those two specific disease states. They may be very hesitant to actually prescribe that product.
Okay. This is more about the dispensary locations, and you may not have any insights on this, but beyond the Ann Arbor location that you referred to, do you know if new business locations will likely offer all of the products that you've talked about already, or are they will they maybe focus more on recreational use? And that may be something
that's a really good question. I have no way of, I know that there are quite a few provisioning centers in Lansing. I have not actually been to any of them here to investigate them. I specifically chose Ohm because of its partnership with the University of Michigan, and the fact that, you know, if the University of Michigan would partner with this place for research, that's why I chose to go and check that one out. I'm not familiar with any of the others locally or at any other places, but there are websites that you can look at that tell you about the different provisioning centers that could give you some contact information. But this is the only one that I had any familiarity with at all.
All right. Any other questions from folks at this point? We'll let people enter those in the chat feature if they want. And I know that Jennifer, you had a slide, I think, that has your email address, so that folks maybe wanted to offline drop an email if you have a specific question that maybe Jennifer might be able to provide some insight on for you. She agreed to just have folks send an email, so her email address is here. Another question came in. As a healthcare professional, are you in support of the state of Michigan passing legalization? I don't know if you want to get into that right now or not.
That's kind of a sticky question. I think for medical purposes, yes. I'm a little less excited about it for recreational purposes. I personally think that it's somewhat of a slippery slope. I do think that it has medical benefits, however, but yeah, I'm not a big recreational fan, but that's my own personal opinion.
Sure. Okay. Well, I just want to take a moment again and say thank you to Jennifer. This was extremely informative and helpful, especially given sort of the plethora of information out there, and it's going to become, seems like, ubiquitous, and at least in the state of Michigan, and probably in the states where it's also medical marijuana or recreational marijuana has been legalized, and just the amount of CBD products and other things that I've seen on the shelves in so many places. So thank you, Jennifer, for taking the time to put this together and share that with us. Really appreciate your willingness to give back to the Alma community in this way.
No problem. Thank you for organizing this, Bill. It was fun.
Good. So again, if you have additional questions, feel free to email Jennifer. Again, this has been recorded, so once we get that edited, we'll be uploading that and making it available on the Tartan Talks website, which is in part of the college's overall website, and so you'll be able to find the links there. So have a great day. Thanks again for joining us, and look forward to having you on for future Tartan Talk webinars.